In this video, we will review the discharge process for a patient who is admitted on an inpatient unit. The first thing we will do is to enter an order that would notify the clerk and the nurse that the patient will require an appointment following their discharge. To do so, we will navigate to the Current Orders button in the black section of the patient's chart.
Then I would click on Enter. From here, I will start typing in appointment. I can now see the first order that appears here is an order for a post-discharge and outpatient clinic or office appointment booking. This order will help nurses and clerks know what needs to be booked and organized for the patient once they receive their discharge. So here what I will do is I will say that the patient would need to go for cardiopulmonary rehab. Then I'll put a brief reason for the referral. If ever you would like any additional details about the process on how these appointments get scheduled and communicated to the patient, you can click on the chevron that will expand the order. In here, I can see that there are some details explaining to nursing and clerical staff about how to book an appointment depending on the type of clinic or physician that the patient would need to go and see.
We can now save and sign the order. Once the booking process is completed, the nurse or the clerk will add the details to the discharge plan, which we will see shortly. You will notice that the order has made its way through the current order table and it is not directly put in the discharge plan. The reason behind this is that there might be some steps required for the nurse or the clerk to get the appointment organized before the patient leaves.
Planning the patient's discharge can get initiated at any point during their stay. You can also access the discharge plan through two different routines. The first one would be the discharge plan routine found in the black section or in the header of your patient's account. So if I click on this, I will get a discharge plan that I can update from here. Any change that I make here can be saved and you can return to the patient's chart. The second way to access a discharge plan would be going through the documentation routine. From here, I can search for any discharge summary templates simply by typing discharge and finding the one that is the most appropriate for my specialty. The discharge planning process can be initiated at any point during the patient's stay. So in this case, I will return to the discharge summary that has been initiated and I will continue editing it. So I can see the document that has been initiated is right here.
Now that I have the discharge summary open, I can see the documentation that was previously initiated. By scrolling down, I can also see an exact replica of the discharge plan as it was found in the discharge tab in the black section.
Any changes that would have been made through the discharge routine would be reflected and carry over into the discharge summary.
The first thing we will do is to reconcile the patient's problem lists. To do that, all you need to do is to click in the white Click to Reconcile Problems box.
When you click on the Reconcile problem, it will open the reconciliation screen. You can see up top you can either reconcile visit problems or all of the patient's problems. In this situation, the patient had a pleural effusion due to their CHF while they were admitted. However, this has been resolved. So I will move to resolved. Type 2 diabetes is something that the patient knows and it is part of their past medical history, so I will decide to move to history. Electrolyte and fluid disorder is also something that was resolved during their stay. All of their electrolytes levels had returned to normal. Edema of both legs is something that's new for the patient. It's not something that they were aware of, so we will keep this one active. Same thing with their diagnosis of CHF. Now that this is done, we can save. You will now see that the reconciliation is now completed and the red star has now disappeared. Following this, we will move over to the medication prescriptions. This section will allow you to do a discharge medication reconciliation, as well as issuing any new prescription for the patient. We can see for this patient that there is already a nitroglycerin spray prescription that was entered. We can also see here with this icon that a prescription will be issued and that it is a new medication for this patient. We can also see that these medications here have no actions yet. So we will go and reconcile the discharge medications. To do so, again, I will simply press on prescriptions. From here, it will launch the reconciliation routine. For the first medication, let's hold it. In this situation, I could either specify a resume date or a hold instruction, or both. It is important to note that once you fill one of the fields, the other one will not be mandatory anymore. So let's say for this patient, I would only like them to resume their metformin if their blood sugars would return to 10. Since we do not have a clear idea of when this could happen, you can now see that the resume date is not mandatory anymore, and I do not need to specify it. If both were specified, both would appear on the prescription. So now we can see that this medication was held, and it is mentioned to only resume it once their blood sugar would be above 10. Following this, I can now see the nitroglycerin order that was placed previously. So I can see any details by clicking on this chevron related to the medication instructions or any notes to the pharmacy. I can also see any kind of information related to the dose or the route. I did not make any change to this medication, so I will simply exit. You can also see some of the information is also visible right up front. I can now see that the prescription for Crestor has not been continued during the hospital stay. To make that determination, I simply review the home medication column versus the visit medication column, and I can see that there is no equivalent on the visit medication. I can also see that there is no link between both medications, saying that a home medication would have been continued during the patient's visit. If we would like any additional details, we could click on the blue eye here to see why this medication was not continued. By clicking here, I can see the details of the medication, and by clicking on the audit log, I can see that the medication was held, and I can see here that it was because the patient had myalgia. Let's assume that during this patient's visit, it was determined that the source of myalgia was not this medication. So we can go ahead and continue it. You will see that this patient does not have any dispensing information, as it's something that the patient was taking at home, and they will simply continue taking the prescription that they had. For this next medication, I can now see that this medication was in fact converted to a visit medication. So this means that when the patient was admitted, this home medication was continued. I can also see by the yellow highlight that there is a slight discrepancy between the dosage the patient was taking at home versus what is currently ordered. In this situation, it is very insignificant. It's simply related to dispensing practices at the hospital, so I will decide to go ahead and continue with the home dosage. The patient has mentioned not having any left at home for this medication, so we could go ahead and issue a prescription for this so that the patient has a few doses until they go and see their family physician. So by clicking on the quantity field, I could simply select that I would like to send a patient home, let's say with 2 weeks supplies or 14 tabs. Another thing you will notice is that when I continued the home medication dosage, it has stopped the visit medication. Next, again, I see another medication that has a yellow highlight. I can see that this medication has had a change in dosage from their home dosage that they were taking. In this instance, I will decide to continue the 5 milligram dosage. So I will go ahead and continue this visit medication dosage. I will also stop the dosage that they were taking at home, as I do not want them to be taking both medications. Another thing to notice in this situation, this would be a new medication for the patient. So for this reason, I will have to explain how many, or to specify how many I would like to dispense for this patient. You can see here that there are some asterisks in front of the mandatory field. So I can decide to either enter a quantity or I could also enter a duration. So if I were to click on duration, it would, and I could specify 30 days as it is explained right here. Now for these other medication, I will decide that this patient was not taking Tylenol regularly at home, so I will stop this one. The patient's course of antibiotics has been completed, so I will stop this medication as well. And for this medication, I can see that there is nothing in the home medication column, so it is a new medication for this patient. Given that I have reduced their dose of bisoprolol, I will continue this ramipril order. Again, since this is a brand new prescription for the patient, I will have to specify how many tabs I would like to dispense. Again, you can edit the information right from here, or you could also click on the chevron to again see more details. In this situation, I will again decide to dispense 30 tabs. I would also like to add notes for the pharmacy for them to be able to provide additional teaching to this patient as this is a new medication. I can now decide to queue and exit. Simply clicking exit would exit this pop-up and would not save any changes. Again, you will see that I could have also edited this documentation right from here. And then for the next medication, I will stop it. If I wanted to provide another prescription that was either not a home medication or a visit medication for the patient to go home with, I could simply select Add New. From here, I can do a search for the medication I would like to order. I will have to select the right strength, and now I can select the right frequency, so I will take a PRN medication in this instance. Again, I would have to specify how many tabs I would like to dispense for the patient. And then again, I can see that I have a dosage, a route, the frequency, and it is also a schedule of PRN. You will also notice that since this is a PRN medication, I would need to select a reason. And now I can queue and exit. Before submitting, you can also click on the preview button here. That will also give you a summary of what has happened while you were managing the patient's medication. So I can see that for this patient, these are new medications that the patient will need to take. I can also see by the icons that a prescription will be issued for these medications. I can see the medication that would be continued. I can also see the medications that have been changed. So I can see here that this medication has changed from bisoprolol 10 milligrams to 5 milligrams. And again, I can see that a prescription will be issued. And lastly, you can see the medication that was held, in this instance, the metformin. So now that I am satisfied with this and I did make a decision on every medication, I can go ahead and submit these medications. Now from the discharge plan, I also have the summary explaining what is happening with this patient's medications. Now that I am satisfied with all the decisions that were made for this patient and their medication, I will return into the prescription routine and I will click on Finalize. Unfortunately, medications need to be changed and you need to return into the prescription routine to finalize. We cannot have it appear upfront. Once I click on the Finalize button, I will get the opportunity to print any prescription that I would like to issue for this patient. So what I would do now, I would simply click on Apply. I can then select a printer from the printer list, which would be filtered depending on the patient's location. I can now then go ahead and click on Apply again. Now the prescriptions have been printed. Now that the prescription has been printed, the physician would need to go and retrieve the prescription as it would require a signature. Here is a preview of the prescription report that would come out of the printer. As you can see, I have the information about the dosage and how many tabs I would like to dispense. I can also see any notes to pharmacy that I might have added, as well as prescription instruction for the patient. When the patient gets discharged by the nurse, they would also get a summary of all the medications that they need to either start, stop, hold, or continue taking at home. On the bottom, you can see that there would be the prescriber's signature. Now that my medication have been reconciled, I will also fill out a return to work form for the patient. This can be achieved by clicking on the prescription or form box. So here I will select a work and release restrictions. I can click and select it. I can also click on the title, which would open the area where I need to provide details. So I will say here that the patient cannot return back to work right now. They would be eligible to go back to work next week. However, once they go back to work, I would like them to have modified or light duties. I would like that to last at least till next month. And I would like to make sure that the patient is not going to be standing or walking for long periods of time. Lastly, I will indicate my own name, saying that I am the one entering the prescription. For this patient, I would also like to send them home with a prescription for compression stockings. So I can click on the prescription for treatment and equipment. And here I can specify the details of what I would like the patient to be going home with. I will then enter my details. Now that I'm happy with what I'm submitting for the patient, I can simply click on OK. Now that I have filled out my forms, I can now go ahead and print them. To print the forms, you can simply click on the printing icon in the upper right corner, and I could decide to print a section. From here, you will see that I do have the opportunity to print the standalone forms. So I can see here I have my prescription for treatment and equipment and the work release form. I will click here and decide to print. Again, a printer on the unit where the patient is situated will be defaulted in this field. However, you could change the printer according to your preferences. For now, I will simply do a preview to be able to view what the report will look like. And here is the output for my form. I can see up top I have the patient information. I can see that the patient also has a prescription for compression stockings, and I can see the justification. And here is where I would sign the order or the prescription. The next form I have here is the return to work. And here I can also see where I might have put any instructions. So I can see here that the patient should not be returned to work immediately, the date they can return, any restrictions on duties, as well as any other instructions I would have provided. And again, here, this is where I would sign the prescription. Before going and discharging the patient, I can also see now that there is an instruction comment box here. This would be used if you wanted to give additional details to the patient or any kind of instructions when they left the hospital. If I wanted to provide any additional instructions, all I would have to do is click in the white box. And from here, I will get a free text box where I can add any details I would like to provide for the patient. After this, I can also see now that someone has entered information for the patient's rehab, the cardiopulmonary rehab clinic that I had requested earlier. Now that I am satisfied with what I have in the discharge plan, I can go ahead and enter a discharge order. This order, once completed, can be and will be sent to the nurse to let them know that the patient would be ready for discharge. However, in this situation, I would like to make sure that the patient voids since they had an indwelling catheter removed recently. I can now go ahead and submit this order. Now that every element of the discharge plan have been entered and specified, I can now go ahead and sign the discharge summary. This concludes the discharge process for an inpatient. Once the nursing staff receive the discharge order and that the patient is fully prepared to go home, they will be able to print a discharge summary for the patient. In that discharge summary, there will be any follow-up that the patient required as they were indicated in the discharge plan. So we can see here that the cardiopulmonary rehab clinic has been sent, and we can see here that someone entered information or details letting the patient know that they will receive a phone call for the date of their first appointment. We can also then see any prescription that might have been issued for this patient and any additional instruction that might have been entered. Next, I can see a preview of the home medication report that will be sent to the patient. As mentioned earlier, we can see here any kind of new medication that the patient needs to take, any continued medication, any medication that would be held, which includes the holding instructions that we specified and any medication that would need to be stopped. There will also be a patient packet that is included with any kind of instructions or education that might have been provided to the patient.